Welcome once again. Hopefully you all can see the slide deck that I'm sharing on the screen. If you can't see it or are having any trouble with the tech side of things, you could go ahead and put it in the chat and somebody will try and help you resolve whatever the issue is. But again, welcome to the inaugural kickoff session for the 2025 short-term grant agreements. Just to recap, these grants are for up to 1 year and $250,000. And we are looking forward to getting you all started so that you can get the work going and get the money that we've made available to you for that work. So with that, I'm going to go ahead and get into our slide presentation here. The first slide just kind of gives you a quick overview of our agenda for today. We're going to start with a brief overview of the Opioid Abatement Fund Council and where you all fit into sort of the larger picture. We're going to go over some pre-implementation necessities. We're going to give you some information about reimbursements. Then we're going to cover the status reporting. We're going to talk a little bit about making changes to either your budget or your agreement after execution. And then Catherine, our tech guru, is going to take you through a demonstration of our electronic grant management system, which is Salesforce based, and show you everything you need to know in there. And then, like I mentioned, we'll open it up to questions, and then hopefully that should be it for today. Okay, so jumping right in, here's a quick overview of the OAFC. It was formed by the legislature in 2021 to have a governing body that ensures that the funds collected through lawsuits against the opioid manufacturers and distributors to make sure that that funding is used fairly and distributed equitably to abate the opioid crisis in Texas. As you can see, there's a funding breakdown on the screen there that shows exactly what happens with the funds as they come in. 15% right off the top goes to the legislature that they can use for funding state agencies for different programs and efforts to address the opioid crisis. Another 15% goes to the subdivision. Those would be like the towns and municipalities that were not only included in the grant agreements, but everybody gets a cut of that. And that's based on some percentages that are broken down in our rules. After the administrative funds and a one-time funding for the legal fees for folks who, indigent folks who need legal services, the 85% that is left, 15% of that goes to our hospital districts. And again, that's broken down by percentage, so everybody gets a share. And then the remaining funds are left to the council to have discretion over for distributing back into the community. And the way that the council has done that so far is we have funded 3 statewide grants, which are currently being administered. The first one was a naloxone distribution. The council put out $25 million for that. And that is being run by University Health in Bexar County. And they are distributing naloxone and training for free. So this is a really good connection for anybody on the call. If you're looking for naloxone or want to connect people with naloxone, these folks can probably get it for you. So there's some links on there that you can use to get in touch with them if you're so inclined. And again, if I didn't mention, we'll also make these slides available to everybody after the presentation so that you can have access to all the links and notes and whatever. The second grant we did was also for $25 million, and that was awarded to Texas A&M University's Health Science Center. And that's for doing prevention and education work in the K-12 setting. One of the really nice features about this grant is that it was designed to help school districts be in compliance with the law that the legislature passed that requires fentanyl awareness training. And so they've been at work all across the state trying to get the word out on that. We also have a $10 million grant that we were awarded to recovery people, and that is for expanding the peer recovery support specialists, increasing the availability of those folks and the training the folks need to become those specialized peer recovery support specialists. The next grant award was this one, the Short Term CORE, which stands for Community-Based Opioid Recovery Effort Grants. Like I mentioned, this first offering was for $25 million, and that was divided amongst all the regions so that a certain portion of that funding overall was available in that region. And folks were allowed to apply for up to $250,000 or 20% of the funding that was available in their region, whichever was the greater of the two. You folks obviously were part of that effort. We had over 200 applications that were received. 109 applicants were actually selected for award. We had 9 of the 20 regions were competitive, which means that those applications had to be selected based on a qualitative comparison. So it was a true competition. And those folks, all applications are reviewed by our independent peer review group, who provides recommendations to the council for award. The total grant funding that we have awarded based on those 109 grants for this opportunity came out to $21.2 million. So almost that full $25 million. So we're very encouraged by the development of this program and how far we've come, and the fact that we're, finally at a point where we're putting the money back into the hands of the community, namely you folks. So thank you very much for applying, and thank you very much for being a part of the program, and we're very excited to get you going. So here's just a quick look at the actual regions and how they're broken down across the state. Like I mentioned, we have 20 different regions. They were originally loosely based on HHSC's healthcare regions, but they've been altered a little bit since then, and I'm fairly certain HHSC doesn't use this map anymore either. So a little bit unfortunate that we don't have, an alignment in terms of those regions, but for our purposes, this works just fine. And like I mentioned, we made up to $250,000 or 20% of the funding for the region available, and that's for up to a 1-year project. So those are our regions. And now that you guys have been awarded, there's a few pre-implementation necessities that we want to bring to your attention, some common questions that we get, so hopefully this information will be helpful to you. First of all, the grant agreements will be valid for 12 months from the time that they're fully executed, which means that they're signed both by you, the recipient party, and us, the comptroller side as well. Your grant agreement specifies that it's the later of either November 1st or the date that it's fully executed. Everybody on this call should be fully executed, so you folks are what we would call live and are ready to go. Just something to remember is that no charges that were incurred prior to execution are eligible for reimbursement. So make sure that you're very aware of what your execution date was, so that you can keep track of that and make sure that you're not submitting any costs that were incurred prior to the execution date. For each grant agreement, we have an assigned grant manager who's going to reach out to you for introductions. Most of the folks on this call, that introduction should have happened already. I think we have a few folks maybe that we still need to get to. So stay tuned for that. We are going to be reaching out. We'll send you an email It has some helpful information along with also some forms and things like that that we need you to fill out. So um, we may also have some changes in assignments, so I'm not sure if that applies to anybody that's on this call currently. But just so you are aware, we might end up reassigning your grant depending on volume as these things come in. So uh, once the grant manager has been assigned and introduces themselves to you, you can consider them your main point of contact. And you can reach out at any time for anything that you may need, and your grant manager will do the best to facilitate, getting you what you need and addressing any issues that may come up. One of the things that we're going to be asking you for is that all grantees must provide their grant manager with proof of the valid insurance coverage that's enumerated in your grant agreement. Some of you folks have sent those in already, so we appreciate that. We're also going to be sending you a direct deposit authorization form. This is so that we can make a connection with your bank, and when you submit your reimbursement requests, so that we can get your funding right back over to you. And then the last thing we're going to need is your proof of your Texas identification number, your TIN number, which is something everybody has to have in order to get funding from the state so that we can pay you. Some of you folks have sent that in already, but we have a sheet that we include that hopefully will help you figure out. I know sometimes people get confused between their employee identification number or employer identification number, which is the number you should have used to apply for the grant when you first signed into the system, and a Texas ID number. So this sheet will help you figure that out, and we'll be there also to assist as needed should you need to apply for an actual TINS number. And then the last point we want to make about pre-implementation is if you're using any subcontractors or subawardees, you are the responsible party for their performance. Your contract is with CPA, so you are beholden to us, but the subcontractors are beholden to you. So if they don't perform, since you are the contracted party, the responsibility will lie with you. So let's go ahead and keep moving along. Okay, so at this point, I'm going to turn it over to Josh, our grant manager, and he's going to talk to you guys a little bit about reimbursements. Go ahead, Josh.
Thanks, Ethan. Good afternoon, everyone. It's lovely to meet you all, at least if not virtually. So my name is Josh Lane. I'm a grant manager with OAFC. And this is probably the section that you probably want to hear the most about, because this is how you receive the funds after you complete the work that your agreement has in it. So a little bit of an overview about reimbursements first, and then I'll go into some more specifics. We can only reimburse costs that have already incurred on or after the execution date, as Ethan has already mentioned. We can't provide any cover any costs that happen before that date. Requests should only be submitted via our grant management portal, which you will have access to very soon. And Catherine will provide an overview and a demonstration of how that's done. We can't accept them over email. It's all done through our system. They're processed on a month-by-month basis. So you'll have budget periods. Each budget period should be 1 month, and you submit them in chronological order. So, you can't submit November before October has been approved. So, it's really good to get all your ducks in a row, get everything in for that month, and then start preparing that next month. And as a result, we recommend that you wait until all costs have been incurred and paid before you submit that reimbursement request. So yeah, and then I think moving on, there are certain things that we cannot reimburse that will be illegal in Texas. An example of that being fentanyl or xylazine test strips, syringe exchanges, and another good or service that we can't reimburse. So please be aware of what the law allows there. Some of you have also included some indirect costs within your budget outside of the indirect cost bill. So if you are billing us for those costs, we need to know that they are an appropriate portion of your overall costs for that specific cost. So for example, if it's electricity, we need to know that what you're billing us is a program appropriate portion of your overall electricity. So we just need to see evidence of that. Usually we do our best to reimburse funds once approved within 30 days of a request. The grant managers, your grant manager will come back to you as soon as possible with any questions, anything, any clarifications. But we do our best to come back to you within 30 days. And then usually it's a week, maybe two, depending on how busy our trust is, to get that paid to you. Ethan, next slide, please. So a little bit more about the kind of nuts and bolts of a reimbursement request. As you'll have seen in your budget and also your agreement, we've split different types of costs into different categories. Usually that's personnel cost or salary cost and associated fringe costs. We've got supplies, travel, other costs, equipment costs. And so everything is categorized into every cost is categorized into those categories. So I'm just going to talk about a few specific categories just to give you an idea of what kind of evidence and what kind of information we need related to those types of costs. So for personnel, if you're requesting a salary of an individual or a certain number of individuals that you budgeted for, we need to see roughly how much time they're spending on their project, and then a portion costs related to that, related to their overall salary. So usually that comes in the form of a timesheet, but there is a template in your agreement, I believe it's the last page, that you can fill out with every reimbursement request and then sign that off, that shows how much time an individual has spent within a particular period on the project. And then you can apportion costs through that. For goods, services, so anything you buy, any service that you engage with, we would usually require an invoice to show that good or service payment has been requested, and if possible, a purchase order. To demonstrate payment, we need to see a receipt. So we can see that a good or service was requested, it was invoiced, and it was paid. We need to see that kind of linear progression so that we can see that it's been a payment has been made by yourself. And if possible, if it's not clear what that good or service is, we need to see or have some explanation from yourselves as to why that good or service is relevant for your program or your project. And then again, as Ethan said, if you have that sub-awardee or sub-grantee, please, you're responsible for pulling their evidence and their cost needs. Make sure you have that contract with them. Please provide us with a copy of that contract so we can know that those costs are apportioned to the program as well. And just make sure that it's clear that the good or service that they're providing is linked to the program. I provided some links, or we provide some links here on travel. So there are certain rules that we have to abide by related to cost per mile or lodging rates or per diems. Everything is within those two links, text, travel, and GSA. Please log everything. Please show what trips are made, how many miles, what dates, so we can then work with you to work out what the total travel costs are. It's a little bit more complicated than the other types of costs. So I do recommend looking at those links in advance and reaching out to your grant manager if you have any further questions on that. And then finally, for all of these costs, we need to see uh, that you have paid that cost. So a receipt is helpful to see what you've been asked for, but we need to see through either a check or an electronic bank transfer, a copy of an electronic bank transfer that that payment has left the bank, that you have made that payment. And again, I'll show you some examples of all of this, so it's not as confusing as it may first seem. Um, a few other kind of just hints and tips really. It's really helpful when you're submitting all of your reimbursement requests that you provide an overview sheet that details all of the costs, what category they fall under, and ideally referring them to a particular piece of evidence. Now I can show you an example of that, but we will also provide a cover sheet that kind of details month by month the reimbursement request spend for each budget category. It's very helpful for us and you to really maintain and monitor costs, particularly when we have particular amounts in each category. So as I say, we often ask for a cover sheet to be completed. This just gives a good overview of everything. But as you can see from the example on the slide, it's really helpful, and this is just in the case of salaries, to have an overview of all the individuals that are you're asking for payment for and kind of detailing them out. Cross-referencing pieces of evidence to that cover page is always really helpful. You know, we can deal with anything between five costs in a month to, with some grantees up to, 40 or 50. So linking pieces of evidence together is really important and is very helpful for us. You're likely, if you don't do that, we're likely going to come back to you and say, can you please explain what receipt equates to what piece of evidence equates to what budget category. So the clearer you can make it for us, the easier and quicker it will be for us to approve and process payment. Yeah, grouping all you'll see when Catherine provides a demonstration, but when you upload evidence, you upload all of the evidence for one budget category into one link. So grouping all that evidence together is really important, making sure, as I say, it's clear, it's neat, and it's easy to interpret. Next slide, please. So again, this is just another very quick example. So this is provided to us by a current grantee. You can see on the page on the left, top left, there's a purchase order. Underneath, they provided the invoice. They've then provided the check and the documentation that went along with the check. All of that is clearly referenced and earmarked. So when we go through that, we can see exactly the chain of, ordering through to payment. And it's very clear that that payment's been made and it's relevant to the program that's being delivered.
And just to add to that, in case it wasn't clear, so the two ends that are in the corners of these documents correlate back over to this document, the cover sheet, so that we can, make the connection that this expense goes with this documentation, which again, the faster we can do that and get through that, the faster we can get you paid.
Exactly. Okay.
All right.
Thank you.
Thanks, Josh. We appreciate all that. I'm going to talk to you a little bit now about status reporting. So monthly status reports are to be submitted through the grant management system in Salesforce, which again, Catherine is going to demonstrate for you in a few minutes here. It should be submitted no later than 10 working days after the month in which you're reporting on has ended. So for example, if you were going to submit a report for October, it would need to be submitted by the 10th working day of November, which in this case would be November 14th. So again, just making sure that you get those in on time will help keep everything on track for both you and us. The reports include a narrative portion, which you'll see when Catherine gets in there. It's basically three prompts to where you can fill in some narrative to kind of give us an update on what's going on. But we also have a section for upload in the reporting. So if you have more that you want to say, or if you can't fit it into the fields that are provided, you can also upload some additional documentation that way. And then the other part of it is a financial reporting piece, which it happens via a CSV file, which you can, again, access right through Salesforce. Basically, what you do is you download it, you fill it in, and then you re-upload it back into Salesforce so that it's available to us to review and approve. And then final reports will come after the project is completed. And that's basically just a way of putting a wrap on the grant altogether. So final reports, final billing, a final closeout report. You'll submit all of that to us within 60 days from the end of your grant agreement, and then we can close you out. And hopefully that'll be fairly simple. Excuse me. The next thing we want to talk about, excuse me, oh, sorry about that, is changes. So throughout the course of your project, it may be necessary, for example, to make some changes to your budget. In some cases, you might require an amendment to your grant agreement. And this is sort of the general process that you would observe for doing that. And you start by getting in touch with your grant manager and let them know what it is that you want to change. Certain changes we can accommodate without a grant amendment. You're allowed to move things around within your budget in between categories, as so long as those changes are not being made to a category that was previously zero. Meaning, if you say, okay, we didn't budget anything for travel, but now we want to make some trips. This 10% would not apply to that because you previously didn't have anything budgeted for travel. But for example, say you had $1,000 budgeted for travel and you decided that you need to make an extra trip for another $500. Again, you would get in touch with us so that we can facilitate, the budget changes have to be made in Salesforce on our end. So you'd get in touch with us. And again, if it's within the 10% limit, meaning it can't be more than 10% of your total budget, then those kinds of changes we can usually facilitate unless, there's something weird or some sort of extenuating circumstance. We also would ask that if you're going to be making staffing changes, that you check with us first, especially for folks who your application was evaluated based on the staff. So we just need to make sure that we're okay with any changes, that if, for example, if you're switching out your project director, that their experience and credentials and qualifications are comparable. So again, usually there's no problem. We can usually accommodate it. But since the contract does stipulate that we have the right of refusal, just to make sure you stay on the safe side, you should just make sure you check with us. Okay, so that's it for changes and execution. So at this time, I'm going to turn it over to Catherine, and she's going to give you guys a quick demonstration of our grant management system. Catherine, feel free.
Hello. Well, thank you all for joining us today. And I'm just going to show you a little bit. Just give me a second while I pull it up. And I'm going to show you a little bit on how to submit your request for reimbursement, or RFR, and your status report within the Salesforce platform. So once you log in, I'm assuming everyone can see this landing page. Once you log in, and it should look familiar because your grants and applications is where you actually applied. Once you're set up with who's going to be the primary project manager and who's going to be your authorized official, Depending on those, what your permission sets will be, we'll see how well you can access some of these tabs. The primary project manager and the authorized official will see all the different things. In this case, for reimbursements, you will have only tiles for grants that you have with us. So I believe all of you or most of you will only see this one right here. And you simply just click. I have a lot more information, so you will see much less, just being fair here. So what you're going to see is for doing an RFR, or request for reimbursement, you will see start request for any that you haven't done. For any that you have completed, you will be able to view them. But you find the one that you need, start request. Just to give you an idea of our naming convention, which could be helpful to make sure that you're doing the right one, we use, in this case, October of 2025. This is the CORE short-term grant. This particular one is Region 1, and the last digits of the individual application are these digits. So when you do yours, it'll be basically the same. So you'll be able to just verify that you're doing like the right month. And what you're going to enter in are the amounts that you're seeking reimbursement for, as long as it meets the criteria that was presented today. Note that you will only be able to request amounts for items that have amounts budgeted. So in this case, you would not be able to request reimbursement for equipment because equipment wasn't on your budget. If you do need to do a reimbursement, let's say on something that you have zeros here, you need to talk to your grant manager. But for a normal month, you just go ahead and you'd enter your amounts in. I'm just going to be very cautious. We didn't do very much.
And while Catherine's doing that, y'all may note that there's two columns, one for regional funds and one for targeted funds. All of your grants are going to be regional funds. So you don't even have to pay attention to that targeted funds column at all. You're going to put all your...
You need to put a 0 in.
Oh, right. Sorry.
Yeah. We have that request to fix, to make it easier. That is in the backlog, but currently you will need to put a 0 in. Also, anything that are zeros here and zeros here, so yours will always be 0 here, but if you have a 0 here, you do need to tell it that you have nothing to report. And it seems kind of redundant, but it is a safety mechanism to make sure that you don't forget anything. So zeros under targeted, and anything that you're not requesting money on, put a 0, and if it's 0 on both, put nothing to report. Submit. And have patience. It'll probably work a lot faster in production when you're normally doing this. So what happens next is all of the items that you requested reimbursement on, you now need to upload the file as Josh explained. So it's going to be your PDF, Excel, Word, whatever document. You pull it from your item. I'm just going to grab something and see if it'll stick. And again, mine's a little slower. This is a sandbox, so it goes a little slower. But you will go ahead and put your items in.
And just to reiterate while she's doing that, only the categories for which you are looking for funding reimbursement for that month are going to show up here. So if you had a category that was 0, it's not going to show up on this side.
Okay. Just to note, it will only allow one upload per category. So you're going to want to, if you have several items, you're going to want to combine them together. So most likely you'll have a PDF, but not necessarily. When you're done, complete request. And what this does now, it sends that request to the grant manager, who will now do their part and review it, reject it, approve it, whatever they need to do. But when you go to view, it's now submitted, and you can look at what you uploaded with it, how much you requested. It's actually that simple. For status reporting, you would click on the tab, and status reporting is set up. There's no tiles. I have a lot of information. That's just because I test everything. You won't see nearly as many, but you will see all of the budget periods that were created. And for this test, I just did 3 months. We have October, November, and December. You only saw 1 month available on the reimbursement because that is a one, you do one, it has to go through the process and get approved before the second one appears. Here you can see all of them. And so you would simply just start new. Get your coffee, think about what you're going to do while it's loading. And here is the request. Again, the naming convention is the same. It's created at the same time. Here, you're going to upload a file, and this is the CSV file. But before you start, and I suggest you do this early, is that you go ahead and you download the template. Have it, and I'm going to show this template to you real quick. It's very, very simplistic. It's a CSV, and it just has these few titles. What you're going to enter, and this is why I say do it early so that you can collect this data, set up your system however you need to so that you're collecting this data. Under allocation category, there's only 2 options, regional or targeted. For everyone on this call, it's going to be regional. So again, here's the categories or the titles. This, you will only put regional for all of you. That's all you can put here. Don't put anything else. This is a date format. Please use 2-digit month, 2-digit day, 4-digit year, and 13/2025. It will not accept any other combination or arrangement. The project, it accepts words or numbers, but the cost, numbers only, region, numbers only, and county is letters only. Just so you're aware, don't put in apostrophes or question marks or anything like that. So you just collect your data and then you're going to upload it. And I believe if I get out of this, I don't know if I'm sharing my screen anymore. So can you see my screen? Probably not.
No, it's gone again.
Yeah. For some reason, it wasn't going to let me do everything. Okay, we should be back, yes?
Yes.
So collect the data as you need to, save it up, submit it. I usually have a blank one. And once you upload, you're going to validate. This is going to put it through a system, and it's going to look for anything that it's, maybe a letter where it's expecting a number or anything it doesn't understand. In this case, there wasn't anything. And then it's uploading it. It's fairly simple, just slow. And then you're going to go ahead and enter in the rest of the information. Note, it allows for 255 characters currently. So you can't enter a lot of data. If you need to enter a lot of data, maybe a large Word document, you can upload it here as a separate document. And then I have to put something. It requires something.
And just generally speaking, so for those three fields, for the narrative status update, we're looking for just, a description of your status and the progress that you're making. Under the notification of any problems, that's where you could, describe any issues you've run into that are holding up progress. And then the last field is for notification of any delays. So if you're experiencing something that's causing the project to get off schedule, you can put that in there. And if there's nothing, you can put NA.
And then the last tab, this award management is, it's a work in progress, but there are some available pieces in there. And one of them is the banking. So only the authorized officials, whoever's designated as the authorized official, will be able to do this. And so you'll click start, and it's a form, and it's the direct debit form that I believe was already emailed to you, but you can enter it in here. You can enter in all that information, and now it's here. So you have a digital copy, and you can complete the copy and mail it back or email it back, or you can enter it directly into here. In the future, we will have things like a dashboard with some great graphics and kind of letting you see how everything is going grant-wise, and also in the future, you'll be able to, the authorized official could update contacts if needed, maybe persons or phone numbers, emails, that sort of thing. That is everything I have. Hopefully, this will allow you to get started. But if you do have issues in the future, any kind of issues that are not programmatic related, but technically related, you can reach out to me directly. And I'll put my email in the chat.
Thank you, Catherine. And just to reiterate, we're going to be sending out the slides in this video after the presentation, but also we're going to be providing you with a how-to manual that basically goes through the steps that Catherine just shared in a Word document that includes screenshots and detailed instructions and all that. So if in the event that those resources are not enough, you can always reach out to your grant manager. And again, like Catherine mentioned, if it's a system issue, we can loop in Catherine and our Salesforce support folks to hopefully get any of those kinds of things resolved very quickly. Let me share my screen again really quickly. So that was the Salesforce demonstration. That's pretty much all we have for you all today. You can see there's some contacts on the screen now. The OAFC.NOFA, that gets to the grant managers. So if you don't have a specific grant manager's email, you can always use that. We also encourage you to visit our website so that you can keep up with the latest on what's going on, as well as signing up for our Gov Delivery, which is a listserv service that, occasionally we send out updates and messages and things like that. Then we also have our quarterly roundtable events, which if you sign up for the listserv, you'll get the announcements for those. And that's just another way that we try to keep transparency as open as we can and to keep communication with the public open. So those are those resources. So before we start with questions and answers, I'm going to go ahead and turn it over to our director, Katie Fallon Brown, to share a few words with you.
Hi, everybody. I hope you're not too intimidated. This is a really, really exciting time for our program and hopefully for you too. I can't say enough good things about Ethan and his team. You're going to get to know each other very well. Ethan Herr, Josh Layton, Coral Beza, or one of those three should be your grant specialist. We might be onboarding some grant specialists in the future. we're just so excited. The council's excited, we're excited, you're excited. We're so excited that we also very much hope to go out in the field, and we want to be there. We want to see what you're doing. We just sit here in Austin and process paperwork, and we want to get out in the field and see what you're doing. Not to criticize, not to judge, but just to see what's going on. And you're gonna hear us and you're gonna hear from us and see us a lot. And thanks for your patience. This is going to be a learning process for everybody. I'm intimidated. We go through all this paperwork, but these are really important state dollars, settlement dollars, even more importantly, that we want to make sure that they're properly expended. So we hope you're still in. We hope you're going to be patient with us. We hope you're as excited as we are. There's already some really good questions in the chat. Extra pleased about this crew being the first ones with the effective grants, and can't wait to hear about how you hit the ground running. I'll turn it back to Ethan. Ethan, do you want me to read you some of the questions in the chat? Would that be helpful?
I think I've got them queued up, so
Okay.
if I miss any, let me know. But yeah, we'll start with the questions in the chat. The first is from Robert Ashford at Unity. To clarify, for salaried exempt, a payroll report showing payment periods plus the LOE level of effort record is sufficient. And the answer to that is yes. You do not need timesheets for exempt salaried employees. We only need timesheets for hourly folks. For folks who are exempt, yes, a payroll report is sufficient. The next one is from Rhonda Patrick. Is credit card statement sufficient if we pay with a credit card? A credit card statement showing that it was paid, yes, is sufficient. If you have that. It just, again, it needs to not show the charge. It needs to show that it was paid. So if you have a statement that shows that, we can accept it. Do we require a copy of the canceled check? Generally speaking, yes, we do want a copy of the canceled check. For anything that you pay with check. Adriana, and sorry, that was Catherine Clarkson. So thank you for that question, Catherine. Adriana's note, oh, sorry, that is not a question. Yeah, a lot of folks noticed that we were not sharing the CSV file. Funding side.
I think the
Is
last
funding
question in the chat. Go ahead.
Yeah, is funding subject to the Texas Uniform Grant Management Standards? Yes, that is, yes. We do observe the Texas GEMS, so we do expect, and that should be expressly conveyed in your grant agreement. So yes, the answer to that is yes. So that, I think, was all the questions I saw in the chat. I see Kimberly Beatty, you have your hand up. Is there something we can answer for you, Kimberly?
Yes, thank you so much. Thank you for this training. I think it was all really clear. The only thing I'm not clear about is when it like kicks off. So this is November 13th. I'm assuming that our contracts are executed. And so does this mean that on December 23rd could be my first reimbursement request? Or did it start on November 1st?
So your grant is effective from the date that it's fully executed. So you can, check your grant agreement. That date will be included. It'll be the date that the controller's office signed. So any expenses from that date forward are eligible for reimbursement. There is no time frame, meaning, once we get to, so for example, if you have a partial month in November, you could submit those reimbursements in November, or you could wait till October and include your costs then, but then it'll go monthly. It's not going to be, it won't reset on the, for example, if you execute it today, your month doesn't go November 13th to December 13th. It'll be the rest of November, and then you start anew in December.
And so I would need to submit the report for November regardless by December 10th.
The 10th working day, yes.
Okay, the 10th working day. Okay.
Yep.
Okay.
And just to add to that very quickly, you could submit a reimbursement request 5-10 days after your execution date. However, we would recommend that you include as many costs for that month within that month. So you could technically include some of November's costs in a later reimbursement request, but I would recommend gathering all of those costs for that period and submitting them one time, because that will make everyone's life easier. However, if there is a cost that you want to get reimbursed ASAP, that is also possible.
Okay, and I just have one more question. So I have not heard or gotten an email from my grant manager. I don't believe I've received one saying, hey.
Yeah, you may not have, Kimberly.
Okay.
Did you just get the invite yesterday from us?
I did.
Yeah, so we had some, so what we did is we invited everybody who was fully executed, but in the last few days, a few more folks got fully executed. So we just sent you the invite to make sure that you could join today, and we will follow up with that intro email.
Okay, perfect. Thank you so much for your time.
Of course, thank you. Rachel, do you have some questions?
Yes. So that thank you guys. It's an honor to be here. So it's real simple. I heard you mention that we will be assigned grant managers that will be working with us. Like, I'm just gonna say it, I'm a little special. I need a little bit longer hand holding. So when I get this manager, I'll be able to work with him or her one-on-one and ask this long laundry list of questions I have on this on this
Yeah.
pad.
Yeah, absolutely. And, the nice thing about that situation too is that if we could do some hands-on stuff. So like if need another demonstration or help navigating the system, yeah, we can do all that with you.
Okay, and we should have someone, you said in the next couple weeks? We can,
If you just received the invite to this meeting yesterday, it'll probably be in the next day or two. We'll send you an email. If you haven't received it yet, yeah, it should just be a couple of days and we'll get that out to you.
perfect, thank you.
Okay. All right, that's all I'm seeing for questions. Again, you can follow up at any time and get in touch with us if you come up with additional questions. So I'll turn it over to Katie to close us out.
Ethan.
Oh, sorry, somebody had a question.
Sorry, can I interrupt real quick? You have one more question from Judith Marshall.
Okay. Yes, her question is if our grant was signed on 11/10/25, will it end on 11/9/26 or 11/30/26? It's 11/9. It's 1 year from the effective date.
Man, that's a great questions from y'all. I just wanted to jump in and say, Rachel, I feel for you. You have a whole list of very specific questions, and we are really good at hand holding, and we try really hard, but we're thinking about trying if we get enough good questions, and we're gonna have 109 of y'all, so we're toying with doing office hours. We're toying with there will be a lot of you with questions, and we are prepared for that. And like I said, thank you for your patience, and we're all learning together. This is I can't say it enough, very exciting. And yeah, we're excited that you're excited and your questions indicate it. So whether it's Catherine with how to log into the system, or whether it's Coral or Josh or Ethan, just reread those intro emails. There's templates, there's forms. We're all blazing this trail together. So thank you for coming up with good, smart questions. Every single question that was asked today is going to be very valuable to all of your peers and all of your fellow grantees. So, all right, I'm gonna be quiet now and see if Ethan wants to say anything before we log off.
Yeah, thank you for that, Katie, and for being here. And thank you all for being here and giving us your time and attention. Just to reiterate, we are very excited for the work that you're going to be doing. And we know how badly it's needed by the people of Texas. So thank you all very much. And we look forward to talking to you and working with you in the future. Thanks, folks. Have a great afternoon.
Thank you.